Welcome to VerifiedRx, your prescription for success. Brought to you by the Vizient Center for Pharmacy Practice Excellence.
The Vizient Summer 2025 Spend Management Outlook is an integrated perspective on the trends, factors, and future expenses providers face across all dimensions of healthcare. Today, we're specifically diving into pharmacy trends, spotlighting 3 new therapeutic insights that debuted this spring. We'll cover autoimmune and inflammatory, oncology, and pediatrics, and preview what's ahead for the fall. My Vizient colleagues, Dr. Carina Dolan and Dr. Jeni Hayes, join us today to help make sense of what's changing, what's holding steady, and what pharmacy leaders need to plan for. Carina is the Associate Vice President, Clinical Oncology, Pharmacoeconomics and Market Insights, and Jeni is the Senior Clinical Manager, Market Intelligence and Forecasting. I'm Carolyn Liptak, Pharmacy Executive Director in the Vizient Center for Pharmacy Practice Excellence, and your program host. Carina, Jeni, welcome to the podcast. It's great to have you back.
Thanks, Carolyn. We're happy to be here.
Thanks for having us, Carolyn.
Carina, let's start with the big picture. What are the most important shifts as they relate to pharmacy coming out of the latest SMO?
One of the most important takeaways from the summer spend management outlook is the continued moderation in our pharmaceutical price inflation. We're projecting a 3.35% increase in the cost of pharmaceuticals for Vizient members between January and December 2026, which is based on Vizient Pharmacy Program participants' purchase data from the past year, and it reflects a modest downward trend compared to prior forecasts. One of the key forces that are driving price inflation decrease is first, early signs of the impact of Inflation Reduction Act. This is due to mandates on pharmaceutical companies that are raising products higher than the rate of inflation. And we can see that the rate of growth for drug prices slowing down, which is helping to stabilize our overall inflation. Second, we have a robust competition for high spend biosimilars such as Humira and Stelara, and these are influencing a lower total spend for these categories. And then third, many high-use inpatient medications have projected price decreases for calendar year 2026, which further assists in cost containment and margin preservations for our acute care facilities. One important thing to note in this report, it does not include a forecasted impact of proposed pharmaceutical and supply chain tariffs, but we'll continue to monitor that situation closely.
Thanks, Carina. There is a lot of information and it changes quite frequently around tariffs. Jeni, one of the interesting headlines from this report is that for the first time, Humira is no longer the top drug by spend. Can you talk about what unseated it and what that tells us about current pharmacy trends?
Yes, this is a big moment for us as we worked to put together the Summer SMO. Humira has held the number 1 spot for years. And this is the first time that it has not held the number 1 spot and has been overtaken this year by immune globulin products, which saw a 22% increase in spend compared with our winter edition. What's behind that shift? We worked with our colleagues in the clinical database to query inpatient discharges and saw immune globulin use increase across several service lines, predominantly neurology. Neurology is now the leading driver of inpatient IVIG use for a variety of conditions, often requiring multiple days, an average of 4 days in many cases. The utilization is really adding up for this product. The combination of spend in the ambulatory area for our outpatients, as well as increased utilization in the inpatient area, combined with having all these new biosimilars for Humira. Humira use is going down and immune globulin use is going up.
Jeni, another shift that caught my eye in this edition of the SMO was the change in therapeutic area rankings. For the first time, autoimmune conditions have overtaken oncology in terms of total spend. What's driving that?
For a long time, oncology has led the top spend for our different therapeutic area categories, and this is the first time where autoimmune and inflammatory medications represent nearly 25% of wholesaler pharmacy spend, and oncology dropped to just under 24%. One big part of this shift is the expanding use of these high-cost, self-administered biologics. So this includes Humira, Stelara, Skyrizi, Rinvoq, and Dupixent, many of which are continuing to gain new indications in dermatology, gastroenterology, and rheumatology. Now this spend is spreading across multiple disease states and different therapeutic areas, gaining momentum for the treatment of these chronic conditions. It's important to note that oncology spend is likely underrepresented in this particular view of the data. Spend management outlook forecasting is based on wholesaler purchases, and a large share of cancer therapies, including CAR T and a variety of cellular immunotherapies, tend to be purchased directly from manufacturers or through different specialty channels. These purchases are not captured in our traditional wholesaler reporting. The actual oncology footprint is probably larger than it appears in our report. We really encourage you to look at your own purchase data to make sure you have a holistic view of where you're spending money. We're continuing to see this shift in supply channels with these limited distribution drugs, with our advanced therapies like cell and gene therapies, which have big implications for budgeting and pharmacy operations. So want to encourage folks to look beyond just their wholesaler spend and through these other channels as well.
You make a good point there. The SMO breaks down pharmacy projection by care setting: acute, provider administered, and self-administered. What are the key takeaways when we look at these segments side by side?
We were excited to roll out these new views of the data in our winter outlook, so we're excited to be able to publish them for a second time at the request of our clients and how they're using this data and making it most impactful for their systems. Even though the overall pharmacy inflation is projected at 3.35%, it's slightly different in these different areas. Acute care is right around the same at 3.34%, which is due in part to some high-use inpatient drugs like Lovenox and Propofol, whose prices are expected to come down a bit in 2026, thanks to improved contracting and competition within those molecules. In the ambulatory space, we have two big buckets: provider-administered medications and self-administered medications. Provider-administered medications are those used in our hospital outpatient departments and various infusion clinics, which have a slightly higher projection at 3.41% due to this continued growth in autoimmune therapies, oncology agents, and different specialty biologics. If we look at our retail colleagues in the self-administered drugs category, thinking about oral therapies, specialty injectables, those have come down quite a bit since winter. So in winter, we were projecting a 4.5% increase. And in this edition, we're projecting a 3.3% increase for 2026, tied back to what Carina talked about with more biosimilars being available on the market for Humira and Stelara.
Jeni, shifting gears a little bit, you and your team recently launched a Therapeutic Insights page that's focused on autoimmune and inflammatory conditions. How does that tie into what we're seeing in the Summer SMO? And what should pharmacy leaders be watching for in this space?
We were really excited to launch these new Therapeutic Insights web pages in the spring, which gives you a deeper dive into these particular categories. We've mentioned that autoimmune and inflammatory conditions are now our number one spend for wholesaler purchase data. The content on our web pages highlights a shift away from the TNF inhibitors like infliximab and Humira, and movement towards IL-23 inhibitors and JAK inhibitors such as Rinvoq, taking a greater portion of market share for these conditions. We're really lucky to have advancements in therapies and new drug targets to treat patients with these chronic conditions. We're still seeing positive effects of the biosimilar competition for Humira as well as Stelara. It's an interesting therapeutic area. It's seen a lot of growth and movement over the past 2 years, and encourage folks to check out that webpage to glean some more of the insights.
We really appreciate you keeping an eye on that because it seems to be changing so rapidly. Carina, oncology continues to dominate pharmacy budgets. What's one of the more significant trends you're seeing in this latest Therapeutic Insights update?
Our data is predicated on our wholesale data feeds. A lot of our data feeds don't include our CAR T products or products purchased direct from a suppliers. Through our wholesale data feeds, we are continuing to see bispecific product growth like blinatumomab, which is continuing to rise in our overall oncology rankings due to its expanded use. Pembrolizumab remains our top spend in our overall oncology rankings, and across the PD-1, PD-L1 category, which accounts for about 24% of all oncology spend, 3 of those agents appear in our top 10 oncology lists. Pembrolizumab sits at number 1, nivolumab is ranked at number 3, and atezolizumab is ranked at number 8. And this category has historically been ranked in our overall top 5 spend since its approval in 2017 and ongoing since then. And we have seen a bit of slowing of this total spend in this space, which is likely due to slowing market expansion and a shift to innovative focus to other targets beyond PD-1 and PD-L1s.
Carina, another issue raised on the oncology page is the role of novel therapies, like cell and gene therapies. What are some of the challenges we're seeing in this space?
Cell and gene therapies represent some of the most transformative advances that we're seeing in medicine today, and they bring a very complex financial and operational set of challenges with them. Even at a low inpatient volumes that we're seeing as these drugs are beginning to ramp up, the budget impact can be substantial, and it's making it critical for health systems to plan ahead in order to adopt these medications. What complicates these things further is that many of these therapies are only available at specialized centers of excellence or qualified treatment centers. It often means referring patients out or receiving referral patients in. So it's introducing a logistical complexity as well as possible delays in access to these therapies and unpredictability in costs and how to budget for these therapies moving forward. And that's exactly where Vizient is stepping in to support our members. We have resources dedicated to this through the Vizient Cell and Gene solution. We also have our Vizient Oncology solution, as well as our events that took place this past April of the Cell, Gene, and Specialty Symposium. And we're helping members stay ahead of the pipeline, make informed decisions, and how to be prepared operationally and financially. Because success isn't just about having access to the drugs, it's also about building the infrastructure to deliver them safely and sustainably and equitably.
Yeah, that could probably be a topic all by itself on a podcast. Jeni, let's turn to pediatrics. The Therapeutic Insights webpage for this segment highlights some important cost drivers and evolving treatment patterns. What should our listeners know?
We're always so thrilled to provide these insights for our pediatric facilities and those that belong to the Children's Hospital Association. One interesting findings from our Summer SMO is that pediatrics has the highest projected drug price increase for calendar year 2026 at 3.93%. And a big part of that is the high burden of inpatient cancer therapies, especially those that are not on Vizient contracts. If you look at the top pediatric drug spend, it's dominated by oncology and immunotherapy agents, those like dinutuximab, blinatumomab, and calasparagase, which together account for a significant portion of total spend. These oncology therapies are truly life-saving, but they come with high costs, intensive inpatient administration requirements, and very few clinical alternatives for these patients. A large consideration for spend are these cell and gene therapies that fall outside of traditional wholesaler channels, and they are becoming increasingly relevant, especially in our pediatric populations. They're adding significant cost pressures, especially for rare diseases and treatment centers of excellence. For example, Zolgensma is expected to receive an expanded indication for intrathecal administration in late 2025, which means centers that are already administering this therapy could further increase their demand and impact budget, again, with these life-altering, highly expensive therapies. Even though these advanced therapies aren't included in our formal projections, they're reshaping the strategy and the course of pediatric pharmacy. They underscore the need for cross-functional planning across clinical, operational, and financial teams, and making sure that you have a solid multidisciplinary program to ensure the success of these therapies for both the health system and the patient.
Thanks, Jeni. Carina, you and Jeni have both talked about how important it is to understand that some of these expensive therapies are not included in the SMO data. What's another reflection that you'd leave with pharmacy leaders after reviewing this Summer SMO and the Therapeutic Insights?
One thing that stands out this cycle is how dynamic and multidimensional pharmacy spend has become. It's not just about list prices or top drugs anymore. It's about shifts in utilization, care delivery models, biosimilar adoption, and emerging site of care strategies. And tools like the Spend Management Outlook and the new Therapeutic Insights web pages, they help pharmacy teams stay ahead, not just in terms of data, but also to understand the contexts behind the trends. And that's how we support smarter, more productive planning for our Vizient members. I encourage listeners to check out the Summer 2025 Spend Management Outlook report, along with the latest Therapeutic Insights at VizientInc.com. And there's so much more in the details, especially around pipeline, forecasting, biosimilar tracking, and domain-level supply analytics.
Thanks, Carina. Where can our listeners get the full Summer 2025 Spend Management Outlook report?
The full report is on our Vizient website, and you can also email us at any time at pharmacyquestions@VizientInc.com.
Well, thank you both for joining us today. We appreciate all of this great information and your clinical insights.
Thanks, Carolyn.
Thanks, Carolyn. It was a pleasure to be here.
Join us for more VerifiedRx podcasts. Subscribe today. Like us. Send us your comments. We'd love to hear from you. VerifiedRx is a prescription for success and is brought to you by the Vizient Center for Pharmacy Practice Excellence. Thanks for listening.